Welcome to Whitman Partners Perioperative Power List series for 2022. Today we have TJ Adams. He is the administrator for North Mississippi Medical Center, Tupelo, and System VP of Perioperative Services for North Mississippi Health Services. Welcome, TJ. Thank you for taking the time out of your busy schedule to talk with us about your experience being a system director, which is kind of a special position, I think.
Well, thank you. And I look forward to our conversation this morning and look forward to providing any insight that I can, but just fortunate to have the opportunity.
Thank you. So let's start with our first question. What opportunity or event launched your career to executive leadership?
So my background is clinical nursing, spent a number of years in the operating room and on multiple surgical services, including the open heart team at Tupelo. Um, I wouldn't say any one event, but I would reflect back and say a lot of hard work and dedication and being humble and being a person that wanted to learn more and ultimately having really good mentors along the way. I can name a couple of physicians and a couple administrators, hospital administrators that have helped me along the way, and then team members, our employees that I've worked with, and other members in our health system have been key to me wanting to do other things in my career and advancing. But to look at one thing, I wouldn't say just one thing has happened over the years. A lot of good individuals that have mentored myself and really push me to be the best I can be. And I've been lucky to move through the ranks and have opportunities.
Awesome. So what is your approach to streamlining initiatives across, multiple sites versus, a single site?
So that's a bit of a challenge. We have several different locations in our system. Our flagship Tupelo Hospital is a 650 bed hospital, which is can be challenging from communication in itself. So trying to streamline that across other OR directors in our system and other procedural areas is a bit of a challenge. I will say COVID has threw its own challenge in there as well with staffing issues, but some of the things we've done is try to utilize technology um, more over the last couple of years from the standpoint of utilizing Teams and Zoom meetings for quick touch meetings, text, quick text with our leaders for updates. Just looking at our technology and how can we get our staff along with our OR leaders together more. I think but that's been a major challenge in the last 2 years given COVID, with staffing struggles, shortages. How do we still communicate and get that to the frontline employees? And some of those ways have been having good conversations with managers and leaders in these in the surgical services realm and also other areas, and having touch points, quick touch points, but feedback. I think we've got to understand what the frontline employees need, and the communication side has been not only technology, but rounding and focused rounding on those staff members. And once we have that feedback, giving them getting staff feedback, but also leader feedback needs to be within a amount of time and a time frame allocated to that.
Right. And talking about, staff burnout and staff shortages, how have those two issues affected North Mississippi, and what have you guys been doing to help address that?
So I wish I could say we've not been affected, but we have. I'm not aware of a healthcare institution that has not. So um, we've dealt with having to slow down in the procedural world and deal with COVID and reallocate staff in our surgical arenas every time we've had some type of surge. So we've had to re-educate some nurses and others that had spent a portion of their time, a large portion of the time in surgery, and by cross training them to inpatient units and overflow units during COVID. Um, but we've also had to deal with pent up volume from the surgical arena when we've had to slow down elective procedures. And once the surge is over, how do we deal with that and bring those individuals back to the bedside for surgical care? And one thing we've tried to do a good job is listen to our staff and provide schedule flexibility. We've seen a number of employees with babysitter issues and things that impact the day-to-day individuals, including myself. And that's been difficult, but one thing we've tried to do a good job is listen to those employees, be flexible around their schedule where we could, and 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 provide a good work environment. Our leaders, our managers, supervisors, I've really stressed to them in direct report meetings is look, we've got to spend time out on the floor. We've got to understand what our employees need, and we've got to give them feedback and do all we can with that leader feedback. And they've overall we've done a good job, but it is a learning process. It's something that you have to work on every day. But I think you have to reflect back of how do you want to be treated as as an employee? If you put yourself in those shoes, how would you want to be treated? And I think we're successful if we do that. We're not successful if we don't do that. And our employees are asking more out of us, and we're asking more out of our employees than ever because we don't have more employees waiting to put applications in. So we have to create a culture that is centric around the employee, but ultimately that culture's got to be centric around the patient because we still have to provide great quality care, efficient care, and have great outcomes.
Right. How have you guys been competing with the travel nursing boom? So, someone can make way more money travel nursing if they chose to. How do you retain people and say that and try and make it so that, yeah, this is better than that, even though obviously they can make more money travel nursing?
Absolutely. I'll acknowledge they can make more money travel nursing, and those that choose to travel nurse, I commend them. There is a need out there, and if they make that decision for their family and that's what's best, we try to support those individuals. If we lose one, and if they're a good employee, we want to welcome them back with open arms. So we've left the door open for those that have left us, if they want to come back. But how have we tried to recruit and retain? That is one is trying to stay market competitive with our hourly rates and our rates of nursing and our surgical techs. And as we all know, that's a moving target. But so that's one way. But money is not always the solution. It's also the culture and the environment that those employees are in, and it also reflects back for the managers and the supervisors of those employees. So I think now more than ever, us holding those supervisors and managers and directors more accountable for how they treat their staff and how they round on their staff and how they grow their staff is how we can retain those individuals. And if we provide a great culture, that also helps us recruit new individuals.
Do you feel that the pandemic has changed your leadership style at all?
I think it has. My leadership style has always been one of rounding, spending as much time in my areas as possible. I have office work. I have to get that done day to day, but I'd much rather be out talking to our staff, talking to our physicians, our surgeons, and understanding what's going on and trying to lend a hand where I can. I think my leadership structures had to shift more technology because time is I'm being pulled in many directions, and how can I get to all the locations and round in those locations and have meaningful rounding versus just walking and not having enough time to listen to staff. And um, so I've utilized technology from the standpoint of any technology from a Zoom to Teams to others to be able to meet with my leaders. One challenge has been having more conversations with staff just because of COVID and um, certain, not having to, not being able to have individuals in a large room, or a number of individuals in a room to ask questions and have town hall meetings and things that we had done in the past. So um, having to adjust to that, and getting employees in front of a computer that take care of patients at bedside is not going to happen during the day. So how do you get in front of them? How do you give them information that they need? So we have employee communication that goes out, that hits a variation of departments, that comes from a variation of departments, but also a challenge has been staff reading emails. So we have creative leaders that have come up with ways to text their groups. We have some closed circuit text lines, group me's, and other things that have been created that employees and staff can share. So we've really had to utilize and leverage technology to get to employees as much as possible too. But as we all know, those individual touch points are the best way to get feedback from our employees. So rounding is key. I would say time management. I've had to do a better job with time management over the last few years, and try to allocate more time to rounding and listening even more. Um, that is a major focal point for myself, is trying to concentrate on listening to our staff's needs and providing them quickly feedback.
Right. So how do you manage like team morale? So like you're doing everything right, you've got the culture right, you're making lots of efforts in all these areas to keep people, but some days are still just hard, obviously, especially with these COVID surges. So what are your thoughts, or what have you guys done on like handling just team morale on the really tough days?
So I would say a lot of different things. One being, as we just mentioned, being visible as leaders. But the morale side has been very difficult the last few years, because the employees have been pulled a number of different directions. They've dealt with both things at work and things at home, and financial, just the normal course of life. But it's been heightened. It's much more of an awareness, especially in healthcare now. So for us, is from a hospital system, is offering everything we can to the employees. Yeah, whether it's flexible scheduling, um, not overworking yourself by signing up for too many hours, and that's a challenge. And I'll say that's one we still deal with today, because we have our workers out there that are willing to pick up 2, 3 extra shifts a pay period. But the balance is, how do we keep them from burning themselves out? How do we manage those individual staff members? And I think there's a psychological, let's edit here, but and reflect back from the psychological health. I think we've done a good job offering that, and making sure that the employees understand we have a employee assistance program if they need someone to talk if they're feeling burnout, if they feel they have any type of need. We've really tried to respond to the employees by saying, please speak up. Please let us know if you're going through something, and we have resources from a hospital healthcare system to help you. Those are ways that we've tried to look at to deal with burnout. But one thing that I think we are all struggling with is, how do we keep burnout from happening in a environment where we are um, down a number of staff members from a day-to-day basis, but we still have to deal with our patient population coming to the hospital from day to day.
You might have answered this, but how do you prioritize resources across all of your sites? So especially during surges, and maybe supply chain issues, like how do you guys balance those things?
So communication. constant communication. We set up a system call at 7:30 every morning to look at what our system looked like from a staffing perspective, and it was with our what we call our PLC, our patient logistics center, that they're our hub for where we have patients across the system, and then working with those individual leaders how we need to flex those individuals to the different hospitals and systems. That's a challenge, but that started every day, especially during surge, and it was a challenge because we might have to move either patient or employee to a different location to just care for that patient for the day, and we have to look at logistics. And our system covers 24 counties, and there could be a number of miles in between one hospital to another. So our leaders started meeting at 7:30 in the morning, early morning meeting, and then we would have meetings throughout the day to look at areas of need during surge. I'll reflect and say it's very difficult, but one thing that we had to do a good job, and that was communicating. I think as COVID began, we did not do a great job and did not have the great systems in place for that communication to happen across the system. I think we felt we I think we felt we did, but as we progressed on, I think we established a very mature communication structure that allowed us to move employees and patients across our system to help prevent surge as much as possible. But each surge we've now seen in our system has had its own issues and different issues each time.
Yeah, and I would say that, you guys aren't alone. I mean, COVID is like a once in a lifetime event. And I think everybody's has had to figure out, how to manage an unpredictable health crisis. Um, so last question. What's like one thing you just love about your job?
Oh, geez, there's a lot of things. I've been at the healthcare system. It'll be 18 years in May. Um, the one thing I enjoy about my job the most are the employees and the people I work with. Um, it's something as simple as walking in the hallway each morning and hearing good morning by numerous people, and each person knowing not only who I am, but knowing that individual's name. That's from the person this morning, the EVS person as we walked in the door that smiles and says good morning, to physicians and other staff members. We have a very open, caring culture at our institution, and it is a strength of it's the Southern charm. And but I would say the employees, the staff, the community, all of the above are things that I really like about my job. Now, the other part of that, the surgical services side, is the daily challenge. I walk in every morning not knowing what challenge I may be hit with today. And we say challenge, but it's really an opportunity. And that could be that we've had a machine break, and how are we going to handle that problem? So a lot of times I refer to myself as the chief problem solver, not the administrator, not the vice president of surgical services. It may just be the person that needs to solve the problem for the day, and they always get elevated to myself for the most part. But that's another issue. That's another thing I love about my job is being that person that can help solve the problem, but also knowing that I'm a small piece in helping improve the care of our community.
Thank you. That's a great note to end on. Thank you so much, TJ, for talking with us today. I hope your peers can get a lot out of this, and people that want to aspire to your position can kind of get a glimpse at what it's like. And so thank you so much.
Well, thank you. I enjoyed the conversation, and just happy to have the opportunity. And if you ever need anything, please let me know.